Robert Redfield. He's this guy, lurking behind the vice president at press conferences about coronavirus, or looking on while the president touts his own scientific prowess.
Every one of these doctors said, "How do you know so much about this? Maybe I have a natural ability. Maybe I should have done that instead of running for president."
He's the director of the Centers for Disease Control and Prevention, so you'll be seeing much more of him and his folksy descriptions of an epidemic.
Whoops, this virus has now snuck up into northern Maine. Whoops, we see it down in Kansas.
While President Trump's approach to the coronavirus seems to involve minimizing the issue, Redfield oversees the federal agency tasked with actually responding to it. And it doesn't seem to be going great. The CDC shipped its first test kits to state labs in February, a month after the world learned of the outbreak in China. But some of those kits were flawed thanks to a contaminated reagent, leaving labs unable to get conclusive results. To date, the CDC and state health labs have conducted more than 8,500 tests. Compare that to the UK, which has a similar number of confirmed cases, or South Korea, whose government has run nearly 200,000 tests. So while coronavirus threatens more Americans and the things they love, like the stock market, sports and church, the agency is playing catch-up while people get sick and die. And Redfield is one of the key people who's going to be answering for it. Luckily for Redfield, he's no stranger to epidemics. In fact, he's a celebrated virologist. When he was announced as a CDC director, Health and Human Services Secretary Alex Azar cited Redfield's pioneering contributions to advancing our understanding of HIV/AIDS. But some of those contributions have been controversial. As the US Army's chief AIDS researcher in the 1980s, Redfield supported mandatory HIV screening for the military, which kept recruits from serving if they tested positive, and led to several active duty troops being segregated, a practice Redfield defended at the time as necessary to control the AIDS epidemic. In 1992, the Defense Department investigated Redfield after he was accused of overselling the effects of an experimental HIV vaccine he oversaw. Though no evidence of misconduct was found, the vaccine ended up failing. The number of confirmed coronavirus cases I mentioned earlier will be out of date by the time you watch this. Whatever those numbers are, it's likely that Trump will be seeking to downplay them. So it's important the CDC director's main concern is the health of the American people, not the health of his boss's ego. Let's see how that's going.
I also want to thank you for coming here today and sort of encouraging and bringing energy to the men and women that you see that work every day to try to keep America safe. So I think that's the most important thing I want to say.
Thank you. I appreciate it.